Bismillahirrahmanirrahim. So the next topic is chronic pyelonephritis. So chronic pyelonephritis is actually the chronic inflammation of tubules and interstitium of the kidney, which is accompanied by the scarring of calyx and renal pelvis. So the causes of chronic pyelonephritis include reflux nephropathy and chronic obstructive pyelonephritis. Reflux nephropathy means reflux of urine. So reflux nephropathy is more common in the children because of the congenital abnormalities in the vesico-uretral valve. So this results in the vesico-uretral reflex and intrarenal reflex. Vesico-uretral reflex means the reflux of urine from the bladder to the ureter and the kidneys. And intrarenal reflex means the reflux of urine from the renal pelvis into the renal papilla and interstitium. So the infection occurring as a result of reflux nephropathy can either be unilateral or it could be bilateral, and it is associated with the scarring of the affected kidney. In the severe cases, there is atrophy of the affected kidney as well. The next is chronic obstruction, which leads to the accumulation of bacteria inside the urinary tract and increases the predisposition to the recurrent bacterial infections. So the causes of chronic renal obstruction include BPH or benign prostatic hyperplasia, prostatic cancer and cancers of urinary bladder, and predisposition to formation of stones or calculi. So chronic obstruction increases the predisposition to the recurrent bacterial infections due to increased colonization of the bacteria, and the repeated infections lead to chronic pyelonephritis. Likewise, there is also increased chance of kidney atrophy in severe cases. Kidney affected by chronic pyelonephritis appears to have irregular scars. As you can see here, scars present on the kidney. In case both of the kidneys are involved, the scarring is asymmetrical, which means they are not symmetrical to each other. Cross-section reveals coarse and dilated corticomedullary scars, as you can see here. This is a corticomedullary scar, which means it involves cortex as well as the medulla. The calyces are dilated and blunted with the flattened papilla. As you can see here, this is a papilla which has become flat and blunt, and it is also dilated. The scars are present in the upper and lower poles of the kidney because the urine enters the renal parenchyma through the polar papillae. So the histological picture reveals the involvement of renal tubules and interstitial spaces. So there is at first hypertrophy of the renal tubules resulting in an enlarged lumen. The lumen is filled with a cast that resembles the thyroid colloid. In later stages of the disease, the renal tubules get atrophied. Since this is chronic inflammation, there are chronic inflammatory cells such as monocytes, plasma cells, macrophages, and lymphocytes. So these inflammatory cells result in fibrosis of the interstitium and around the calyx epithelium. The arcuate and interlobar arterioles also get sclerosed, and the lumen of these arteries get narrow, resulting in hypertension. Glomeruli also get rarely involved in the disease, but ischemia does some damage to the glomeruli, resulting in glomerular fibrosis. Chronic pyelonephritis has a silent and a slow onset. That's why it is difficult to be noted in the early stage, but often there is a repeated history of acute pyelonephritis with typical signs of inflammation and pain at costovertebral angle. The patient also presents with the signs of inflammation such as pain at costovertebral angle, fever and malaise, and some nausea and vomiting. There could be a history of frequency, urgency, burning micturition, or dysuria. The cause of chronic pyelonephritis must always be evaluated, such as urine reflux or chronic obstruction. There is often proteinuria in the later stages of the disease due to involvement of glomeruli. Chronic pyelonephritis, when detected in the late stage, can also result in chronic renal failure or end-stage renal disease, in which the patient requires dialysis and renal transplant. So this concludes our section of urinary tract infections. If you have any questions, do let us know in the comment section. Thank you.